My first time getting NeoGen
R.
Oh my God, I almost said PSA. This is a public service announcement. Welcome. Love first times.
Tell me a little bit about what you would like to work on. Wrinkles, all right. What you have, we can make better. This is the NeoGen PSR. This is taking nitrogen and converting it into nitrogen plasma. So it's going to go just underneath your skin and activate all of that collagen to come back to that youthful appearance. And so it will grow. It takes about 9 months total for it to work. So it's constantly working. You'll notice a difference today. The first one's in Nashville, the NeoGen PSR. So
Love being the first.
Neo kind of stands for new, and then Gen is like NeoGen, so you're going to create new skin. And then the technology that it uses is the plasma. It's not the plasma like you think when you think of the vampire facials. We do all of those procedures here too. So we actually will draw your blood. We'll spin down to get the plasma.
Yes.
Yeah.
Yes.
This is a different kind of plasma. This is like the solid liquid gas plasma as an element, not in the plasma in your blood. And so people get confused when we talk about the NeoGen plasma machine. So there's no blood draw.
The same for male and female, or like for facial hair for men, can they do that?
Yeah, so the way that this works, it will sort of eliminate any of those little hairs that maybe you can't even see that everybody has. And then for men, we have to work around their hairline. We have them shave if they want to have that done, or if we just want to work above and just do eyes, forehead, cheeks, and they keep their beard, they're welcome to do that.
Is it gonna hurt?
So no, we're going to use some numbing medicine. It's going to feel like a little hot, like,
Okay.
and you'll hear when we start doing it, it's little pops, but it's just like a little bursts of hot air.
Okay.
And so we'll use some numbing medicine, and we'll use some other cream.
And how long does it take?
For just doing the face, maybe 30 minutes
Okay.
or less. Just depends on how much stopping and starting we do or talking about it.
Okay, so face, here we go.
All right.
Step 1, take your makeup off.
Just some numbing cream, so we're going to put that on there, and we're going to let this set for about 20-25 minutes. NeoGen PSR actually takes nitrogen, so the gas, and it heats it and electrifies it, and then that's what penetrates underneath your skin. When we think of the other type of plasma, the vampire facials or PRP procedures, that's actually taking your blood, your whole blood, spinning it, and that gives you the platelet-rich plasma, or the PRP, from the top. And then we can use those, that's not this, but we can use those for the eyes, hair restoration, microneedling, and that's a good procedure too because it's your own plasma, and so there's no reaction to it. All right, so now it's time to remove the numbing cream, and I'm going to start with your eyes to make sure.
So how did you end up to be one of the first in Nashville to get this machine?
Yeah, as we were looking with Rise Nashville to try to figure out the best services to offer, we looked around and looked at a lot of other machines. This one gave the best benefits and with the recovery times that people are looking for, so they can choose between those two treatment types, whether that's that low energy or high energy, and so they can come in on their lunch hour and be back to the office and no one knows anything happened. The NeoGen PSR, a lot of people will come in and say, is this a laser? Is this a chemical peel? And so all of those things are taking your skin off or burning your skin. This is actually keeping your skin intact and working from the inside out. So it's your own body repairing itself. That's why the downtime is less. Patient satisfaction has been amazing. You'll hear this constant flashing, and then there will be a pause. And so the pause is going to be because as the machine heats up, it needs to take a cycle where it cools itself back off. You want that skin to be really tight so you don't have any sagging skin below your jawline.
Oh, it doesn't hurt at all.
Like a warm air, like a...
Yeah, it's warm, and I feel the warmth, but it doesn't hurt at all. And I'm a baby.
It's important who you have working on your face. Here we have very well-trained providers, and we spend a lot of time, and the company we work with the NeoGen PSR, spends a lot of time, energy, and resources to make sure that we're very well-trained. So the eyes make people nervous, because they don't. There you see. We're able to go in your eyes, over your eyes, everywhere. You can use this NeoGen everywhere. Elbows, knees, vaginal, Anything that's skin that you need tightening, it can do. You'll feel a little bit of skin tightening, but you'll also then start to grow that thickness back out.
Okay.
So it'll sort of rejuvenate your skin. So a lot of people like the skin on their neck. It also works for sun damage. So a lot of people will want this
like
area.
right here.
Yeah, so they'll do this sort of this whole neckline, and
Okay.
so it removes sun damage. You can use it for actinic keratosis, seborrheic keratosis, psoriasis, all of those things that are like skin disorders that gets underneath there and helps you regrow new skin. People do their elbows, tightens all of this loose skin here as you get older. Hands, it does a great job with hands, so it takes all of the age spots off. The hands are pretty dramatic when they're done. Takes a few weeks, but you'll notice a difference. So a lot of women want their knees done.
What would they do?
This just tightens all of that skin around your knees if you have a lot of skin laxity around there. This is a full service med spa.
Oh, yeah?
So we do Botox, we do fillers. We're really about look good, feel good. So there's a lot of it. It's a full aesthetics practice. Also the sexual wellness or intimacy medicine. We're talking about rebalancing hormones, treating sexual arousal disorders, both in women and in men. So we have a suite of erectile dysfunction treatments, as well as weight loss. So we also do the GLP-1. That's like your Wegovy and your Mounjaros, tirzepatides, Zepbounds. It's just the injectable medicines that everybody's talking about right now. They're diabetic medications to
like
start with.
Ozempic,
It's a
right?
really good jump start. Gives you time, I think, to help you get some of that weight off, and then you have to do a lifestyle change.
Exactly.
So and a lot of people think that the medication is the only treatment. It's a part of the treatment. It's done really well for so many people, honestly. Like you just see really dramatic results, and then it gives them that opportunity to sort of like get out and get moving. It's harder when you're carrying 30, 40 extra pounds sometimes. The things you can do really after treatment, you want to make sure that this has time. It's going to create like an inflammatory reaction, and so your body's going to want to heal this, and that's what makes you grow new skin and new collagen. And so you don't really want to be doing heavy exercise for about 3 or 4 days afterwards, because your body will focus on the muscles that are being built and tear and not focus on your face. You can definitely walk.
Okay, good.
Just do a little bit of aftercare, so it's all about hydration. So you want the skin to stay as hydrated as possible. So we're just putting on some Aquaphor. If you look at your skin, you'll notice your skin will start to feel dry, and when it does, you just want to make sure you just keep it completely hydrated. Tomorrow you can wash your face. You just want to do it really lightly with like a very low, non-abrasive face cleaner.
My face feels so tight. It feels so weird. I just got home. I still have a lot of Aquaphor on. I'm not supposed to touch my face. It's still numb, but I can feel it tightening for sure. Every time I get procedures done, it always gets swollen, especially this side. So when I ask you a question, repeat the question.
Okay.
Just for the audio.
Okay.
Don't do a facial routine at night?
Not with this.
I totally feel my face getting numb. This is normal. My face is getting so numb. It's like I'm trying to talk. Set this up on the tray. Okay. Pull up the selfie stick, tilt it down, and do a time lapse. If you don't want to hold it, and just let it time lapse. Should you put it in, if you're close, put it in cinematic mode? Do you know how to do that? Or
You want to do low energy?
yeah, just because like I'm seeing my boyfriend. I haven't seen him in like a month, and so I don't want my face to be
No. He won't even know.
gross.
No, it'll look great.
I don't ever wear these, so you.
I don't either.
Okay, now do it. Do it again. Do it a few times. And so when you do it, I want you to move your hand.
It doesn't go like immediately.
It does better. Try one more time.